Hey there, future RN, and welcome to ClearPath NCLEX. Shock medications are one of those topics that are so heavily tested. So today, we're going to cut through all the noise and really focus on the 5 key drugs you absolutely have to know. By the end of this, you are going to feel so much more ready to tackle those questions. Let's get right into it.
Okay, so let's put ourselves in an NCLEX scenario. You've got a patient in shock, and you see that blood pressure just tanking. What is your absolute #1 priority? Is it to immediately reach for a drug to get that blood pressure up? Just think about that for a second.
If you thought no, you are exactly right. Here is the #1 rule. You have to burn this into your brain. You've got to fill the tank before you squeeze the pipes. You always, and I mean always, correct hypovolemia, that's just low fluid volume, first. See, if you give a vasopressor, one of those squeezer drugs, to a patient who doesn't have enough fluid, you're basically just squeezing empty pipes. That can cause way more harm than good. This rule is absolutely fundamental for the NCLEX.
Okay, so let's jump into our first category of drugs. I like to call these the squeezers. These are your go-to vasopressors, and their main job is to constrict those blood vessels to bring a patient's blood pressure right back up.
First up, we have epinephrine. Now, if you're ever in a code blue, you are definitely going to see epi. It's kind of like a triple threat. It hits alpha-1 receptors to squeeze the vessels and raise BP, it hits beta-1 receptors to speed up the heart rate and make it pump harder, and it hits beta-2 receptors to open up the airways. That's exactly why it's the #1 choice for anaphylaxis. But with all that power comes risk, so you have to be watching super closely for things like hypertension and dangerous heart rhythms.
Next up in the squeezer family is norepinephrine. I want you to think of this one as epi's more focused cousin. Its main job is just powerful vasoconstriction by hitting those alpha-1 receptors hard. And yeah, it is a little bit of beta-1 activity to help the heart out, but really, its claim to fame is clamping down on those blood vessels to treat really bad hypotension and shock. And just like with epi, you're keeping a hawk's eye on that blood pressure and heart rhythm.
All right, let's switch gears a little bit. We're moving on from the squeezers to a category I call the pumps. These drugs are all about improving the heart's contractility, making it pump more effectively.
Okay, let's talk about dopamine. This drug is so versatile. It does work on those alpha-1 and beta-1 receptors like the others, but it has this kind of secret weapon. It also stimulates dopaminergic receptors, and this is really unique because it actually increases blood flow to the kidneys. That makes it super useful not just in shock and heart failure, but in renal failure too. And hey, here's a silly little trick to help you remember its main use. If you see a patient who's lethargic, kinda out of it, you might think, why are you acting like such a dope? And then hopefully it'll click, oh, wait a minute, you might be in shock. Let's get you some dopamine. It's a little goofy, I know, but it really works.
Next in the pump category is Dobutamine. Now this is just specialist for things like cardiogenic shock and heart failure. Its whole purpose is to stimulate beta-1 receptors to really increase the force of the heart's contraction. The key difference here, and this is super important, is that it does this with less of an effect on the heart rate and blood pressure when you compare it to dopamine. It's a much more targeted approach to improve the pump without totally stressing out the heart.
And of course, we need a way to remember Dobutamine. If you look at the name, you can see Dobutamine. So the little mnemonic is, oh no, that bud is mine, and it puts me into heart failure. I know, it's a bit of a stretch, but I promise you will not forget that Dobutamine is for heart failure.
So let's just quickly put them side by side. Dopamine is like your multi-tool. It increases the heart rate and has that really special ability to improve blood flow to the kidneys. Dobutamine, on the other hand, is more like a precision instrument. Its primary job is to boost that contractility with much less of an impact on the heart rate, making it perfect when the pump itself is really the main issue. Okay, let's move on to our final medication, which actually works in a totally different way. I want you to meet albumin, the volume puller. It's not a squeezer, it's not a pump, it's what we call a colloid, and it expands volume inside the vessels. Albumin works pretty much like a fluid magnet. It literally pulls fluid from the body's tissues into the blood vessels, which rapidly increases the plasma volume. This is perfect for treating shock, hemorrhage, and burns. But, and this is a big but, because you're pulling so much fluid into that vascular space, the single biggest risk is fluid volume overload. And that is exactly why it is absolutely contraindicated for patients with heart failure. Their system is already overloaded with fluid and just can't handle it.
To help you remember how this works, I want you to picture this little story. Al is a bum. He's just sitting outside a store, and everybody who walks by brings him bottles of water. This should help you picture albumin just sitting there in the blood vessels, drawing in water from all the tissues around it.
So now that we've covered the drugs, let's talk about what is arguably the most important part,
Your role is the nurse, because knowing what to monitor is every bit as critical as knowing what drug to give in the first place.
So here is your safety checklist. First, you are basically glued to those vital signs. Continuous blood pressure and heart rate monitoring is completely non-negotiable. Second, you have to watch that EKG like a hawk. Dysrhythmias are a really common and potentially deadly side effect of almost all of these drugs. And third, you have to be assessing for fluid overload. That means listening for crackles in the lungs, checking for edema. Your assessment skills are truly what keeps the patient safe.
You know, at the end of the day, these medications are incredibly powerful, life-saving tools. But that's all they are, tools. It's your sharp assessment, your critical thinking, and your constant monitoring that truly makes all the difference. Never ever forget how vital your role is. You can totally do this.
And that brings us to our final thought for today. A key side effect was a risk for nearly every single drug we discussed. Which one of them demands that you look at an EKG immediately? The answer, of course, is dysrhythmias. You have to lock that in. Thank you so much for watching ClearPath NCLEX. If this helped you out, please give this a like and subscribe for more high-yield content. And drop a comment below. Let me know which shock drug you find the trickiest. You are doing amazing work, keep up the studying, and I will see you in the next one.